This is Dr. Tori with RookieDoctor.com. Let's go over another quick tip for your medical school clinical years, your internship, and your residency. This one applies to all of them, and it's pretty simple but pretty important. And that is, it's better to call than to not call. Now, I mean when you're calling your attending, the attending on call, a consultant on call, a resident or chief resident, an upper level resident of yours, a fellow. If you have a concern, a clinical concern that could impair the patient in some way, harm the patient in some way, if you don't take action or if you don't make the right decision, and you're on the fence about it, you're unsure, you need to call. And all of us have been there where we're unsure, like, oh man, I don't want to call this guy. It's 3 in the morning, and I should know this. I should be okay with this, but there's this and there's that, and you're weighing all of these options and you're going back and forth. It's better to call than to not call. For your patient, obviously, but also for what your attending is thinking. They might be upset if you call in the middle of the night. They might be upset if they think you should have known it. But at the same time, they would be far more upset if there was a bad outcome and you didn't ask when you needed to ask. So if you're at all on the fence, jump over that fence and call. It's that simple. It's a very important tip. It's ultra important. It could mean life and death for your patient, and it could mean the difference between a good and a great evaluation by your attending. So it's a no-brainer. If you're undecided and you're on the fence and it could help or harm your patient in some way, you need to call. Very simple. That tip that I've mentioned at internship-tips.com, that's where I go over the #1 tip that actually a mentor of mine pulled me aside and gave me this tip, and it completely renovated, reinvigorated, and revolutionized my training. So no matter where you are in your training, if you are a 3rd or 4th year medical student, if you're an intern, or if you're a resident, this is an important tip. So go ahead, go to internship-tips.com and check it out.